Okay, hi everybody. I'm Patty Saylor. I'm going to do your welcome today. I am a nurse that works in self-directed services for many people, and I'm a board member of the Self-Direction Advocacy Network. Mostly I see familiar faces, and you all know what SDAN is, but for those of you that may be joining us brand new, SDAN is a group of 6 volunteer advocates and family members of people who self-direct and other concerned professionals. And we have formed to advocate with DDA in particular and to support people who are self-directing. And we try to garner your issues and your concerns and turn around and take those concerns to DDA and other folks that influence and impact our lives. So we have a general membership meeting today, so we're going to update you on things that SDAN has been doing and try to get some input from you all. Sometimes our meetings are topical and we have guest speakers to bring some issues to you. This is not one of those meetings. This will just be general with general updates and an opportunity for you all to ask some questions. Again, when we open to questions, it's impossible in our time period and in our role to actually answer your specific questions about your specific situation regarding yourself or your loved one. But we can try to give you some general answers or possibly be able to point you to where to go to get your answers. And then we always like to have your questions and concerns in the chat, but then you can also email us if it's something more involved that you'd want to talk about. We continue as a board to meet with Deputy Secretary Simons and his leadership team on a monthly basis. They do express interest in collaborating with us and meeting with us regularly to understand what you all are dealing with. And you know, it's one thing to make policy and have some ideas at the state level, but it's another about what you experience on your end, on the end for the participant. So we do have that forum every month that we're able to take your concerns and your experiences directly to Deputy Secretary Simons and his team. So we're going to go ahead and start the PowerPoint, and the PowerPoint will lead us through our discussion today. So this gives you a little bit of a insight here as to issues we're going to talk about, and you can see that on the screen. Okay, we ask again, just for our meeting etiquette, that everybody remain muted unless you're called upon at some point to be able to open your mic and chat. But, you know, out of courtesy to everyone, we keep the noise level down. Use the chat for questions. If you can't use the chat for some reason and you want to raise your hand, use the hand raising feature and we'll call on you. Certainly that's an accommodation for people who cannot use the chat. It is recorded and it'll be on our website at some point as quick as it can be there, and closed captioning is available. So I'm going to turn it over for our first section to Alicia.
Okay, so I want to let everybody know that the Self-Direction Act of 2022 passed. As most of you know, it was a 3-year endeavor. And a lot of you contributed your time and energy in writing letters and doing testimony, and just wanted to let you know how very much that was appreciated. It was a lot of hard work, and we thank our sponsors, Senator Susan Lee and Delegate Karen Lewis Young, and your support of them would be awesome going forward. Based on input from SDAN members and from that 6-month summer study that actually went through December, the law was crafted. It did pass. It is going into effect as of October 1st. And I thought I would let people know some of the key elements that we had in there to strengthen self-direction, to keep it person-centered, flexible, and meeting the needs of the people it's intended to serve. And of course, as you all know, with all legislation, we may or may not have covered everything. My guess is that as we get deeper and deeper into how it actually looks, we may not have covered everything. Some things may need a tweak, but we definitely have moved the needle in the right direction. And just want to give a big shout out to everybody on the call and everyone who helped. So let's do the next slide and we'll talk about some of the key elements just to remind people who know it so well and to educate anybody who hadn't been involved up to now. So the key elements of the SelfDirection Act of 2022, and if you notice the SelfDirection Act of 2022 is blue on our PowerPoint, that is a link. You can pop in and take a peek at it. Last time I looked, it was the third reader view, which makes it a little more challenging to read because it's got additions, crosses out, cross outs and all that. But you certainly can read the language, and it will be tightened up as I understand it whenever the administrative people there get to it. So the first piece is it increases support broker hours up to 30 and the scope as per a documented need in the plan. It does require a support broker if the participant chooses to hire family as staff. And we see this as a safeguard for participants and also as an opportunity to reduce any perception of conflict of interest in terms of what the state might see. The next thing it does is increase funding for individual family-directed goods and services. Of course, again, within reason and related to need is documented in newer person-centered plan. It requires the training of CCSs on self-directed services with the intention that the training be such that the CCS can be a true support to you as we all continue to use self-direction. It requires that people be informed about all waiver options. In other words, when you're new to DDA waiver, you get that option of a provider or self-direction, and that option is intended to be presented at each annual PCP. This is a little bit narrower piece, but it allows for transportation reimbursement for those specialized vehicles that may be owned by someone other than the staff person driving it. So it allows for reimbursement to the actual vehicle owner. The specialized vehicle owner, again, would need to be documented in the plan. It requires parity in funding. So parity in funding, those of you who've been in self-direction a long time, it used to be that self-direction had its own sort of interesting budgeting system and providers had a different one. But as of a year ago, we use the same rates. So we have the needs documented in terms of the services, number of hours, times the exact same rate as a provider would get. And that's the parity we're talking about. So it requires parity in funding. And it also takes an interesting step to increase transparency in the process. So as you know, participants who self-direct their services rely on their CCSs to put the plans in, and then there is no official way for a participant, a person, to be able to track the process of that, other than all the communications typically go through the CCS. And so this will hopefully allow better understanding, better transparency to the process where things are, and allow the participant to know directly what's going on, what's the situation, where is it in the pipeline. One of the most interesting and new things is there is to be an access to cover some administrative costs and staff to perform those kind of admin tasks. So it is sort of directed towards people who maybe don't have family who can do that for them in a free or gratis way. It's a way to have people get the support they need, making doctor's appointments, scheduling staff, et cetera. So this may help us a great deal in terms of, the after we're gone for families, and for participants, of course. It gives a way to have things run smoothly and somebody in charge of helping them, assisting where they need it to get these administrative things done. And lastly, as you know, overnight supports was granted in May by DDA, but this bill does ensure that it stays. And it also ensures that family and its staff remain available to participants who choose that and document it in their PCP. So I hope that gives you a thumbnail sketch of all of the things that were included. Rather dramatic and remarkable number of things, and it will be interesting to see how this actually moves forward. But I feel like it's very positive, and I'm hoping that we can count on all of you again to give us your input when we get something from DDA, and as we go along in the process to actually create the policies and possibly the administrative amendments to the waiver that will allow this to all be documented. So next slide. So that's, I guess, what I was just trying to say, that some of the elements of the law may be implemented right away that won't require a waiver amendment, and others will. So we are absolutely committed to working with you, our members, and with the DDA on implementing this new law. So that's kind of the update on SelfDirection Act of 2022. And I think we'll try to move down. I guess there's one other piece before Meg starts the FMS update. Just as a reminder, because the FMS kind of cued me, just a reminder to let you know that the COVID-19, what are they called? COVID-19 is the Appendix K. The Appendix K is winding down. It will end as of June 30th. So don't forget, that means all of those, first aid, CPR, everything needs to be all done. And yeah, I got 15 days. So just wanted to throw that in there. Any questions you have, please put them in the chat and we'll try to address that in more detail later. Sorry, go ahead, Meg, you're up.
Hi, my name is Meg Carter, and I'm an SDAN board member. And I want to remind everyone listening that it's not just the board members that are SDAN, it's all of you. And I don't think there's any better example of your advocacy and actually your power than the resolution of the 5-year FMS controversy. So, I'm just happy today to say it looks like it's been resolved in a way that should work for just about everyone. Since 2017, SDAN members have reported that they support choice of essential fiscal management services. Like every other aspect of self-direction, you need to have quality choices. But you didn't just report that that's what you wanted. You backed up your commitment with actions. And, in 2019, you packed a hearing room. We had 60 SDAN members pack a hearing room in Annapolis to support choice of fiscal management services. That summer, people even had an impromptu protest, across from DDA headquarters to support choice of fiscal management services. And again, that's all you. You wrote hundreds of letters to the governor, to your legislator, to the Board of Public Works. And, it's been 5 years, but all of those letters and calls, all of that had an impact. It really paid off. So on June 8th, the Board of Public Works approved contracts that allow 2 new national vendors to come to Maryland, which we are thrilled about. We think they're going to bring new ideas and a fresh approach and an option, for people who self-direct. The 2 new vendors will be Public Partnerships Limited, a national vendor, and GT Independence, another national vendor. But the Board of Works approved their contracts. It also approved a contract for Arc of the Central Chesapeake. So they will continue to offer services in Maryland. So, we are just thrilled with that outcome. And in the next several months, we'll meet with the vendors I believe that the new vendors are able to offer their services as of July 1. I'm honestly not sure about that, but I think that's when they can start offering their services. And we'll be meeting with them to learn more about what they can offer and, to try to, there are hiccups in almost every transition. So, what we will try to do is avoid bumps in the road, or at least let people know if bumps in the road are coming up. But I think it's time finally to thank MDH for its cooperation, for Board of Public Works, especially the Board of Public Works and their staff for working so hard to come up with a solution that's fair to people who self-direct, fair to devoted Maryland businesses, fair to everyone. And so, we really thank the Board of Public Works for doing that, especially for the staff who supported that. And again, thanks most of all to your advocacy, because if it hadn't been for those letters, those calls, that packed hearing room, this would not be happening. So again, thanks very much to all of our SDAN members.
Okay. Hi, I'm Ginger Houston Ludlum. I am one of the board members of SDAN, and I would like to talk for a couple of minutes about an effort that we have started in the last couple of months on our Spark Tank grant. So every year, the ARC of Maryland gives the opportunity for nonprofits to apply for some funding to support innovative ideas to support people with disabilities. And so we applied and were given funding to be able to start working on what we call a DSP portal. And I'm going to describe what I mean by that in just a minute, okay? So here's kind of the big picture that we see, and none of this is going to be a surprise to anybody, okay? People who self-direct their services require really good quality DSPs because the quality of the DSPs is the quality of our self-directed programs. And so, but one of the problems, of course, is that there is a limited number of DSPs, and sometimes people are willing to work and participants need a DSP, but there's no way to put those two things together. And so this was the problem that we were addressing in our grant proposal. So this is the big picture. Ultimately, this is where we would like to go with the project. You can see that big box that's a dotted red line. That is the piece of this that is covered by the grant. But let me just talk about the big picture first so that you see where we're trying to go. So we want the ability for self-directing participants to be able to post DSP positions that are available. So this is where the help wanted ads would go. And the potential DSPs would be able to look at this database and be able to match with self-directing participants who require their services. And the other half of this is DSPs who want to post jobs wanted. And so they would post their availability. We would have some very basic information. So this is not a full-blown, you're going to know everything about this potential DSP. You're going to have a limited set of information that's kind of a first cut. So you know that they're willing to work in your area. You know that they have a car and are willing to drive. You know that they have the basic certifications that you require for this particular self-directing participant. So that is the piece that we are working on prototyping right now. The third part is we want to take a look at what we can do to just increase the number of DSPs available. And we are starting with education places like community colleges and universities, to see if we can snag people who would actually like to do this as a career. And so we are going to be putting together a presentation. We're going to be reaching out to a few community colleges. And I want you to remember that, because when we talk in just a minute about things that you can do to help us, that is a huge piece of stuff that we could really use some help with. Okay, so At the moment, we have done the first step in our DSP portal, and that is we put out a survey. And I want to thank everybody who responded because you gave us some awesome information, and it really has informed how we are going to proceed with prototyping this DSP portal. So that part is done. We've produced the report and submitted that to the ARC. And now we are actually starting to think about implementing the proof of concept. So the next thing that we are going to do is we are going to do what's called a paper prototype. So we are going to put together what the screens might look like, you know, and how you might navigate to put information into this database. And so again, one of the next steps we are going to ask for is just a small number of people who would be willing to kind of test this out for us and give us feedback. So you're going to be like the beta testers of this portal. And so, so that's really the big next step that we're working on. So, as I said, item 1, paper prototype testing. If you are interested in helping us out, if you would put your contact information in the chat, you can private chat it to the host, and we will be able to reach out to you. Please put an email address or some way that we can actually reach out. Okay. I want to be very clear. This thing that we are producing is going to be a prototype. It will not be live yet. Okay. We are going there, but right now we are in the testing phase. Okay. And one of the big things that we are concerned about is protection of this data. So we are going to be hacking testing, and we're going to be doing all kinds of stuff to make sure that scrapers can't get DSP information, that anybody who does not have legitimate access to this information can't get to it. So once that is all done, then hopefully we'll be able to go live as soon as possible. We would love to have you help us reach out to CCSs to make sure that they can help us populate the database and that they make it available to people who self-direct so that it will assist them in finding staff people. And then the last thing, and I hope everybody is doing this all the time, talking up being a DSP as a career path. So this is an amazing, rewarding career that nobody knows about. So I'll just sort of share a little bit of our personal journey. So we actually just recently hired 2 new DSPs. The first DSP we hired was a former coworker of my daughter. So she had formed this amazing relationship with this coworker, and I saw this happening, and it was like, wow, this would be an amazing DSP. So once she left that job, she was fair game, and I facilitated reaching out and hiring her as Carmen's staff person, because Carmen basically said, yeah, I'd love for her to work for me, you know, and I would love to have that relationship. And so I just facilitated making that happen. The same thing with DSP number 2. She was a college student that was part of a student club that my daughter Carmen participates in. Super relationship. And Carmen said, yeah, I'd love to have her as a DSP. So I reached out, and she'd never heard of a DSP, and I explained to her what it was, and it was like, yeah, I'll come hang out with Carmen. And so that was number 2. And number 3 was a tutor that was looking for a job. It was a volunteer tutor, and she had to leave a previous job. She's also a college student and needed a little extra money, and so she's now our 3rd DSP. We just finished hiring her very recently. So if you kind of look around and you see who's making amazing relationships, you know, who is it that the participant wants to work with? And it may not be somebody who's already a DSP. It may require some educating on your part, okay? So please think about all those people that you interact with, and how can we turn those amazing people into DSPs? Even if you personally don't need a DSP right now, let's build the pool, okay? Because someday you will need one, and let's have somebody in that pool of people for you. And we would love to hear really innovative ideas about how you found your DSPs. So please put that stuff in the chat so that we can perhaps publish a best practices for recruiting DSPs. So, okay, that is all I had to say. So
Carol, I think you're up.
Hi, everybody. There were several increases in rates that were
Carol,
not.
you want to introduce yourself for anyone who's
Sorry,
new?
sorry. I'm Carol Custer. I'm a board member of Self-Directed Advocacy Network. I'm also a support broker, and I'm going to try to help you understand the COLA, which isn't that complicated anyway. There were a couple of different increases in rates, one of which was a 4% COLA increase, which created a raise in the reasonable and customary rate chart that is effective on July 1, 2022. I believe that there's a link in the PowerPoint or on our website or wherever, guys. Tell me
In
where
the
it is.
chat. It's in the chat.
In the chat. Okay. That will explain it. Some of you were aware of the CDS grouping of 1 to 4. We discussed that, I think, in a prior meeting. After a meeting with DDA, that was changed so that the rate of 1 to 4 for self-direction is the same rate as 1 to 1. The whole issue of 1 to 4 is still an issue, but right now the rate is the same. So you're getting enough money to pay an entire employee, since all self-direction services by default are 1 to 1. So you want to look for that effective July 1 rate. When you were doing your plans, they told us at the end of May that you could use those rates if they were effective July 1 and you had enough money in your budget already. There was another process coming out that if you didn't and you needed to access the unallocated funds, or you needed to up your budget based on July 1, as of July 1, the rates in the LTSS system will be these new rates. So if they rerun your budget, service budget based on those new rates, it will automatically go up, but it's going to require process that they said was asking for a revised budget only, and it's supposed to be easy. So stay tuned, listen to, we'll try to update you as we learn more. They're still using the COVID Form 5 beyond June 30th. So, but they're expecting to modify these forms later. They may bring back some version of the old plan modification, if any of you are familiar with that. So just know that it's there. Know that as of July 1, your employees can go up to the new reasonable and customary rates that are on the form dated first it was dated May 25th, then they revised it on May 27th, and the effective date is July 1. And I did just pull it off the DDA website, and it's in our chat. There's a second one that is that includes all of the rate increases, which is for the providers. And it's a 5-page document, and it's incorrectly states self-directed staff reasonable and customary rates, but it's actually the provider reasonable and customary rates. And it's got the actual full rates for all of those services if you have to hire a vendor versus hiring a staff person. So if there's any questions, you can put it in the chat. And that's pretty much all there is.
Next slide then. Carol, hang in there.
No, there's more. That's what I just did that.
I think you did it, but I thought we'd just get there so everybody can see the links to things on the PowerPoint and the date and how to access. So thank you, Carol. I think we're ready for next slide. So Ginger, you're up with the sustainability project.
Okay, so one of the things that many of us have been concerned about is what happens to these amazing self-directed lives when parents are no longer in the picture and able to kind of help do things, especially the things that we all do for free. And so we are going to be starting what we're calling a sustainability group. And we're going to be thinking about lots of things like housing, like staffing needs, like, all the sorts of things that we need to think about to be able to make sure that these amazing lives continue after we're no longer able to be there to assist. And so if you are interested, I know that the last meeting we also asked the same question. If you are interested in participating in our sustainability work group, very likely once we have our first couple of meetings, we'll break off into working groups for various different topics. But if you're interested, please put your email in the chat or email us at info@marylandsds.org, and you'll be added to the list. And I am hoping very shortly to start the first meeting. So hopefully within the next 2 weeks. So for those of you who are wondering, you gave us your email address last month and probably haven't heard much, it's coming. So we're going to be focusing on that probably starting in a couple of weeks.
And Ginger, this is Patty. I would add to that, individuals who are self-directing, who are doing that independent of family now, but how does your life or what you've put together now as your self-directed package of services on, how do you sustain through the aging process as well? So not simply for those folks that are being supported a great deal by family members, but for those folks who are not, it is still the same issue. How, we've built a system of supports that is current, and how does that sustain over your lifetime? So welcome to join in if that is your situation as well.
Yes, please. Thank you, Patty.
And I'm happy to say in the chat, there are quite a few people who are interested in being part of that work group and project. So we're very grateful to all of you who are interested in doing that. That's fabulous. All right, Ginger, you got yourself a work group.
Awesome.
Next is the support broker forum that has had, I think, its second meeting, and Kim Mans had run the second meeting. So I'm going to ask her if she wouldn't update everybody on what it is and where she's planning on taking this. Are you there, Kim?
I don't see her in the list.
She was there earlier. I did look for her, so when I introduced her, I wouldn't have this issue, but we can, if she's not here, we can come back to that later. I can just explain that Sarah Holland, who was a CCS and a support broker who's working with SDAN, got a group of support brokers together to try to create an ongoing group of people, support brokers who would work with each other, support each other, hopefully connect with SDAN so we can increase our advocacy by, support brokers work with a lot of different people. So it's just another form of information gathering for us. And Kim Mans kind of started it, the second one, and I think that was last week, maybe the week before. And I believe that it's intended to continue on. So if you have an interest in being in part of the support broker forum and did not know about it before, please leave your name in the chat for that as well. And we'll make sure that information gets to Kim Mans. And I think Paulette might have been involved in it as well. So we're excited about the support broker forum. Next, I think Patty's going to give you a little update about nursing work group.
Sure, thanks, Leisha. Nursing impacts many people in self-directed services, certainly if you have an HST level of 3 or above. And then there's also many people, well, some people in self-directed services who require skilled nursing services, which would be kind of shift nursing. So nursing is in many people's lives, and for those of you, just to give you a little background on it, the nursing regulations don't appear to have changed for many, many years. I can't remember, and I've been a nurse for 35 years. I can't remember. Oh gosh, that makes me feel really old when I say it out loud. I'm not aware or can remember when nursing regulations have changed. So as disability policy and waivers change, and options like self-direction and freedom and choice and control and all that evolves, nursing regulations have not. So, many of you that know me know that I've been barking about this for years, and I just want to let you know we're gaining some traction at getting some folks involved to look at nursing issues. I've met with Secretary Beatty and her team. I met with Disability Rights Maryland, and they're interested. So there is some conversation and some traction right now to look at nursing regulations as they apply to people self-directing and other services, but our interest, of course, is self-direction, and how what recommendations might need to be made to bring nursing regulations along a bit to evolve to not be a hindrance to your lives and an unnecessary intervention where is obviously meant to be a health and safety safeguard, but how could that happen without being holding people back? So we'll just I'll keep you informed, but I'm optimistic that we actually have a little energy behind looking at this. Folks don't want to take on complicated issues that require law changes. That's generally not what people want to do with their life. So I'm pleased to report that we have a little bit of energy to look at this because I know it affects many. And that's it for that one.
Okay. Next slide, I guess. So Ginger and Liz.
Yeah.
This is, now they make me talk. Hi, everybody. My name is Liz LaFrance. I'm also an SDAN board member. And like Patty said, every month we meet with DDA and we represent you and your concerns. And part of that is we know there's a lot of issues going on with the person-centered planning process. So we have a poll for you, and we hope you'll all participate in it. I'm not sure quite how it runs, but Ginger's going to run it. So we'll just go over it really quick. There's demographics. Oh, here it is. Can you guys all see it? Great. I won't have to talk.
Yes.
So are you a self-directing participant, a family member, a direct support professional, a professional who works with self-directed participants, an FMS, Fiscal Management Service representative, a CCS, a coordinator of community services, a support broker, and scroll down, or other government person. I guess,
And you can check multiple boxes. So if you are a family member and a DSP, you can check both of those. So, yeah.
And you can make the screen bigger if you need to, or if you have trouble with the poll, feel free just to put it in the chat, and we can get back to you with it after the meeting. Anything like that. But we really want to hear from everyone on this. It's important.
So it looks like it's slowed down. So let's give it another 15 seconds and then we'll go to the next one.
All right, this is a big one. Is your plan or current budget, is your plan and budget current and or approved? I guess approved. Yes or no? I guess it's a snapshot.
Okay, let's give it another 15 seconds.
Yeah, so we want to try to answer quickly so we can get to your questions. Okay, clarification request. This is when you submit a plan and DDA comes back asking for more information or want something changed, that kind of thing. So you have multiple clarifications. One round is good, more than one we're trying to avoid. And a lot of times participants don't know at times, so you may just answer to the best of your ability.
Let's give another 10 seconds.
Just through your knowledge.
Number 4.
Number 4, denials. Did anything get denied, or did you have to drop any needs to get your plan approved? Yes or no?
Number 5.
Number 5. Did denials causing expiration, that's a That's something we're looking for. Did any of the clarifications or denials, the process being longer than you would have liked, cause your plan to expire? So you've gone past your annual date and your plan is not approved yet.
10 more seconds. Okay. And then last one.
In limbo. In limbo. Have you submitted your plan on time and not heard back from the process within the required 20 business days? Is it just out there and you don't know what's going on?
Okay,
While people are doing it, I think I just want to say that somebody put in the chat, there is a group of people who submitted there's a large group of people who submitted in June, probably for a July 1 start, and the 20 business day period hasn't lapsed yet. So for those people, we're not going to get a clear understanding of what's happening in this next 10, 15 days. So I totally get that at least because of this, as questions are being asked at this particular time, the people who have the July 1st may not have complete information to answer all of these. So.
Yeah, and adding your experiences, just your additional comments in the chat are really helpful too.
Or if it's very private, you can also email it to info@marylandsds.org. So.
Right. Or direct message just the host in the chat if you prefer. All right, it's question time.
That's great. Thank you, everyone, for taking the time to help us understand, with real live data. It really helps in our conversations with DDA to let them know that our memberships are reporting, that their plans expired and what percentage they are, and that there are multiple, up to 6 and 7, I'm seeing in the chat, clarifications that people did either get something denied or had to drop something from their plan. That was at 41%. Denials causing expiration, 29%, and didn't hear within the 20 days. Now, I just do want to clarify, it's 20 business days, so it's kind of better if we all think along a month time, but that was also 36%. So clearly there's some process issues that we can help DDA be more aware of in terms of how our members are experiencing this PCP process. So thanks again. I'm also seeing some issues in terms of difficulties in CCS, either knowing the program or responding in a timely fashion. And that's also great information for us to be able to pass on to headquarters. Do you want to clear the poll from the, I don't know if you can do that, Ginger, clear the poll from the thing, but so if you have any questions, please put them in the chat box. If they are more personal, feel free to email us at info@marylandsds.org. So I am seeing a few questions. Now my chat went away. So let me get that back. Do you think it'll pop back? Why is it not showing it to me anymore?
You probably need to click on chat.
I am. There we go. It's back. Okay. So earlier on, I'm going to cover some of those. Somebody asked about the administrative piece of the bill, and it will have to involve, we think, a change to the waiver. So the process for asking for that and receiving for that is absolutely not clear at the moment. And one person asked about parity in approvals. And I think the parity we were talking about is the parity in the rates and the funding. But it's an interesting idea about the parity in approvals, because I do believe if this question was intended to say the regions are not consistent and there isn't, I would say, parity in approval processes, but it is something for us to continue to let DDA headquarters know. Ginger, somebody else was asking, is there going to be a fee for this Spark Tank DSP portal? Do you want to talk about the thoughts there?
Absolutely. So once this goes live, we actually already have agreement from the DDA that we can use some of that $500 recruiting money that everybody can take advantage of in their budget. So so essentially, if you ask for it, you automatically get this $500 bucket of money to be able to do things like post ads, all that sort of thing. And so that's kind of what we're thinking about, is being able to use that piece of the budget to fund this particular thing. So participants would use that to be able to access the information, and DSPs would be able to put their information in for free. So that's basically how we think that this will be sustainable.
Great, thank you. Somebody else asked, when are plans approved for new people? And my understanding, Carol, if you'll correct me if I'm incorrect, but plans should be approved within, still the 20-day period, but I believe all transitioning youth, which is transitioning youth group, start July 1. If you're a new person, as in you were in DDA services with a provider and you're switching over to self-direction, and I know there are a number of people who are doing that, theoretically, once you put in your plan, 20 business days or approximately a month, and I am aware that it typically isn't that smooth. I will say and somebody pointed this out, there's more than just, DDA process issues. There's also CCS training, speed at which things are communicated to a person's team and then back to the CCS and back to DDA. So there are multiple glitches that could happen to a person. So, but it's important for us to know where they are so that we can help at least inform DDA as to where they are. And if it's a training issue with CCS, is address those pieces. So somebody is talking about out-of-state mileage. Carol, do you want to talk about what we understand as far as that goes?
There's a lot of things like that up in the air right now. It definitely has to be in the plan. Bernie Simon said in one of our meetings that if you live on a border and it makes sense for you to go to another state to do something, then you absolutely should be able to do that. So my understanding is that if you put it in your plan where you're going and why you're going there, not so much why, but that you will be going to places out of state on a regular basis, it's supposed to be approved. I know that some clarifications have come back this year questioning that much. So it's an ongoing thing that we ask you to keep us posted of, and we are continuing to bring the issue up to DDA. And as far as it being in Comar, I saw that question. We do have people in our organization that are reading Comar on a regular basis. I don't know that we've found anything explicit one way or the other on that. The waiver doesn't specifically exclude out of state, I don't believe, but it's just one of those biases, I guess, for lack of a better word, about state versus out of state.
Given our conversation, we just basically just touched on this issue. And we definitely got the impression from Deputy Director Simons that given the right circumstances, as in you live closer to another state or you have a compelling reason to go there, or there's some unique opportunity that's there, that given substantiation in the plan, that there didn't seem to be any administrative reason why that couldn't be approved. So I feel like there's quite a few people who've put in their plans and haven't gotten them back in a timely fashion. And the reasons are hugely varied, as everything is based on an individual person. But I think in order for everyone to know, for DDA to know that this is happening, perhaps see a letter from the participant to the CCS, to Christy Colbreth, who is our self-directing statewide coordinator. If they hear from you, it's been, 30 days, 50 days, 60 days, it's been 6 months. If they get a constant flow from participants about a delay in getting plans approved, then they're going to be more likely to jump on that and to fix the problem area. So I would encourage people who are transitioning from providers into self-direction, new transitioning youth people, and just people who are just trying to get an approval, for their next fiscal year. If it's been, and it's like not on day 21, but starting day 30th, it's reasonable to ask the question, where is this in the pipeline? It's been X number of days, and to be on it, or to ask your CCSers to be on it for you. So just
Hello.
kind of a
Hello.
yes.
You're asking us to go ahead and get in contact with people, but you're not providing any information to us about who to contact. Can you please send out an email to everyone on this call saying who to contact? That would be extremely, extremely helpful.
Sure, we can do that. And we can
Thank
put
you.
Christie's email in the chat too.
That would be fantastic. It would be very, very helpful.
Great,
Thank you.
thanks for asking. Oh, there it is, Christy Colbreth at maryland.gov.
For those of you who don't know, she's the new statewide coordinator for self-direction. And she said that if you're having issues or delays, she doesn't mind you reaching out to her.
That's great, because my budget was sent in by our coordinator the end of January. We still have not gotten anything from DDA regarding what my son's approval. There's been no approval.
So
Thought we're going on.
I've seen you, I
4
saw
months
what you
on,
have
5
in the chat, and transitioning from one service model to the other service model will take longer than 20 days. And there was another question about, does the 20 days reset every time there's a clarification? And DDA has repeatedly said that it does, but that is more true when you're doing a transition and a brand new plan than it is when you're renewing a plan. When they're doing the plan renewals, they seem to be much faster in getting back with the clarifications. But yes, Robert, you can email us independently, but what you're going through is not unusual for people getting into it the first time, unfortunately.
It
Yeah, I
isn't
mean,
unusual.
I've had to go ahead and extend my son's autism waiver because we haven't been getting any information from them. The central coordinator for DDA is inaccessible. We can't, EDD folks, inaccessible. The whole process has been nothing but inaccessible people in terms of trying to get information about where my son's application is in the process. It's extremely frustrating.
Christy should be able to help you.
Absolutely.
Okay,
Yep.
Thank you.
Try Christy, and then in each regional office, there is a regional lead, which you can also contact and escalate up to the regional directors as well. So
I'm pretty sure I'm dealing with the regional lead, and he's
okay,
not really helping
squeaky
me much.
squeaky wheels. So go to Christy.
Yep.
Yep.
Okay, thank you.
Yep. I'm seeing the out-of-state mileage is definitely an issue for quite a few people. So we'll go through this chat after and just kind of get some data on that as well.
Alicia, this is Patty.
Yes, go
Could
ahead.
you make it's come up quite a couple times there. Could you make the distinction between the PCP being approved and the budget being approved?
I don't think
Carol?
there is a distinction.
Yeah, I
between
don't
them.
Well, if the FMS cannot pay out because they haven't gotten the approved budget, right? It's come up a couple times in the chat that.
Okay,
that,
so this did happen to my son personally. We had the PCP approval and there was just literally somebody didn't send the budget over to the FMS. But typically the budget is really part of the PCP. They are kind of integrally related. And so it is assumed once the PCP is approved that the budget is approved also. So I think what we're talking about is the fact that somebody at the DDA doesn't get the budget to the ARC. I don't know, Karen Bradbury, I saw you were on the chat. I don't know if you want to jump in and say where you feel like the questions are, or problems are from that side.
Yeah, I mean, typically when we receive the approved PCP from DDA, the approved budget will also come over. I think right now there's a bigger lag in people getting approved for the actual waiver through EDD than any hangups with DDA.
Okay, so EDD seems to be the hang up,
Can you describe what EDD is, please, for people who don't know?
including me.
Patty, putting me out on the spot. I
Well, it's
think
going to be
EDD
eligibility,
stands
right?
for Eligibility Determination Department.
I'm going to jump in. It actually is the federal arm, so to speak, of the funding. So once the DDA
Who's
approves-
speaking, please?
Sorry, it's Esther Ward. Once the DDA approves, it is finalized. That DDA decision is not finalized until the federal arm has a look on it. It's usually pretty much a rubber stamp approval, but that is an extra step. It does take time. What I have found to be very helpful in this, especially since it's a very process, is reaching out to your local delegate and having them get involved.
Thank you, Esther. I mean, I do see, and I think for Robert, his issue may be one that could escalate to that. I have had experience myself and also seen other people get some quicker attention brought to the issue by going to your delegate or senator. So Paulette, you had your hand up.
Yeah, I just wanted to, Paulette Roseborough, support broker and parent to someone who is using self-directed. I am having the PCP approved, but not the budget. So we're sitting waiting for the budget to be approved. And we get these verbal approvals from the CCS. We have to go back to get the budget, to get the PCP copy, only to find out that we can't do anything with it until the budget gets approved, which is in limbo somewhere. So I don't know what the problem is. I don't know, it seems to be happening more and more now than it has before, but there is a distinct, it appears to be a distinct difference between the budget being approved and the PCP being approved. And the only thing in the PCP is the DSA. So it's not the actual budget.
Okay, thank you.
So let me tell you what I found in my clarifications for my clients. They seem to be excessively going over what is on the budget sheet. So the clarifications coming back are more about things on the budget sheet than actually written in the plan, like the number of miles a week for mileage, or the number of weeks of paid time off, that kind of thing. Has nothing to do with the overall approved LTSS budget, but it has to do with how it's utilized. This is new. This is not something they had done in the past, but I think we've been on a really good hiatus for 2 years because of flexibilities from COVID. So those are things that we need to hear too, Paulette, if you think that's what's happening, specifically when we talk to DDA next week.
Can I be heard?
Go ahead.
This is Dennis Shiflett. I can tell you through great experience recently, there's much confusion about the 20 business days. And DDA has at least been clear on that. The 20 business days is applicable to what they refer to as a review. And that review comes out of your regional location. So it's being confused that DDA has 20 business days to approve or deny your plan and or budget. That's not the case according to all the correspondence that's been going on for months now. But I'm not seeing that being shared Also, the second thing I've learned is although Christy is our new self-directions, person reporting to Rhonda Workman, the actual decisions, as it's been shared with me, is made by the regional director in terms of your self-direction budgets and plans. I'm open to be challenged on that. I can only share with what I've experienced.
Okay, thanks, Dennis. Esther, let's get your hand up.
Thank you, Alicia. I'm getting conflicting information on this. The DDA recently got a company to do the HRSTs once again. And I am currently onboarding an amazing amount of individuals onto self-directions for the first time. I am getting conflicting information as to who is allowed to do that HRST, being, does it have to be the company, which is very backlogged, to do that initial HRST, or is an independent nurse still allowed to do that HRST, or is she barred from doing that HRST, the initial HRST right now, and can only do the subsequent quarterly reviews moving forward? Does anyone know the answer to this?
We're going to let Patty, our nurse guru, on this one.
Thank you.
So are you, Esther, are you assuming that when you refer to independent nurse, are you assuming that that nurse is an approved DDA nurse?
Yes, she is a DDA nurse who I've used in the past.
Right, and is she in the plan and budget? Because sometimes the cart is before the horse, right? So
of course,
somebody you're onboarding, they'd have to be in the plan and budget, right?
So I always do that. I've taken the new rate and I've plugged that in. She requires 16 hours annually, and we plug that in as well. So in my requested budget, yes, it is there. But remember, these are individuals who are coming in for the first time. So technically, they don't even have a budget.
Well, that's the point, right? There is no way. So a couple things from a nursing standpoint. For one, if we're not currently working for someone in their plan and approved in their budget, there's no avenue for payment to us. Right. And there's no avenue to actually reach the person's HRST. So we have to actually be working for the person in an approved plan with a way to be paid and a way to access the HRST. So if that is possible, then yes, an independent nurse could do it. But if it's not possible, that's why they have that contract agency, because they have a mechanism for payment and they have a mechanism for the nurse to access the HRST before the individual has it approved in their plan or budget.
Okay, so in a working forum, in not a philosophical way of doing this, but in the day-to-day, that is going to mean that the contractor is the only one that's going to have access to that HRST. I can't imagine CCS is circumventing and doing the extra paperwork in order to allow an independent nurse to do that initially. So
yeah, I mean, this is what we've been dealing with for years, right?
Yeah, totally. Right. And really, thank you so much, Patty, for everything.
More questions in there, Alicia? You're on mute.
I thought I fixed that. There's some ongoing confusion about rates versus wages. I don't know, Carol, if you want to take that or you want me to?
Rates versus wages. All right. Rates is what DDA has agreed to pay a provider for that service. Rates are what the budget in LTSS is based off of, the current rate at the time that the plan is put into the LTSS system. Wages are what they have determined to be reasonable and customary rates, which is on that chart as of July 1st. However, thanks to a lot of hard work by SDAN, there is the ability to have an exception form completed if you want to go above what they have determined the limit of the reasonable rate is. That exception column lets you go up to the rate minus the 14% for taxes and insurance, workers' comp, and unemployment insurance, which is the fringe rate currently charged by, I think, both, well, at least by ARC. So that's not supposed to be something DDA has the option to approve or not to approve. It's supposed to happen. If you check off something on that exception form as the reason why you're going above the reasonable and customary rate maximum, then it's supposed to be accepted as not questioned. So we would like to know if you're being questioned on that as well.
Right. And always, if you're having some issues and you're writing to people, we would love it if you would copy us at the info@marylandsds.org. So we learn a lot from you in terms of, you know, what's going on and what the hot button items are. I think there needs to be one more clarification about the difference between, let's say, personal supports and personal supports enhanced. Carol, do you want to do that one or want me to?
You're perfectly capable, but I'll.
Okay, well, go for it.
Personal supports enhanced is an HRST score of 4 or higher, or a behavioral plan. They have now seemed to tie that when I looked at the rate sheet for that was amended on May 27th. They seem to be making that same exception, and I can't remember where I saw it, but I did see it for the difference between CDS 1 to 4 and CDS 1 to 1. But again, the rates are the same now. I don't know that that will stay that way since they still have those two distinctions and how your service plan is going to be populated into LTSS, but it has to do with a need for like one-to-one supports, arm's length supports, health issue because of health issues, seizures, and other issues. And then if you have behavior issues, especially in the community.
So just to back up what Carol said, in our last meeting with DDA, we spoke about this very clearly, and both Christy, but they all agreed that to get the enhanced supports, you need an HRST of 4 or higher, and or a behavior or nursing plan. So if you had a lower than 4 and you still require a one-on-one because of a nursing issue or a behavior issue, you would need that support to request the enhanced level of service. If you have an HRST of 4, 5, or 6, that is considered substantiation enough, and you shouldn't have to supply anything else. So I saw a few people in the chat, and I actually know of a clarification that came back that way of asking for additional substantiation with a participant with a HRST score of 4. HRST is health risk training score.
Screening tool.
Screening tool, thank you.
So let me chime in on that one.
Chime in.
It certainly could be possible that you could have an individual or your loved one could have an HRST level of 4, 5, or 6, and you qualify them for the enhanced designation there for personal supports. And you may not have a nursing care plan. And that would happen if all meds and treatments are being done by unpaid people. So your nurse is providing you consultation. Your nurse is not providing case management and delegation where they would have written a care plan. So if you are doing all the meds and treatments by unpaid people, and you have a HRST of 4, 5, or 6, you may need to ask for a nursing care plan be written. Certainly there's a nursing assessment that would have been done by your nurse that you have on your team. So again, there may not be a nursing care plan because you're not delegating to med tech staff, right? So you need to request something from your nurse that would satisfy DDA, whether it's an assessment or a care plan, but you might not automatically have one because all that meds and treatments and things like that are being done by unpaid people. So you might have to ask for that in order to satisfy DDA.
What does enhanced personal supports include versus regular personal supports?
Money.
Ah,
It's a
got it.
higher rate.
It's a higher rate.
It's a higher rate. So-
There's a hand raised, Linda Klein. You have to mute.
My son must have raised it. I'm sorry.
Oh,
I
that's
don't
okay.
have a question.
Okay.
Okay, thanks.
All right. Is there anything else that I mean, I know there's other little things that I have not gone. There are questions about what qualifies for individual family directed goods and services. And that's just a really tough one for us to answer. There are the qualifications in the waiver for what that would entail. I don't know, Liz, if you are prepared to talk about what that says or not, but for really particular things that needs to be justified in the plan, as long as they meet those criteria that's in the waiver, should be allowable. Liz, you want to chime in?
Sure, I'll put the waiver description in the chat. It's very brief, but I mean, we can, the description is brief, but if you read the criteria, I think it's about, off the top of my head, I'm blanking, but if if it meets the criteria, ask for it, they can only say no. We get things like gym memberships, I think, directly from the waiver, gym memberships, not covered dental work, electric toothbrushes, and exercise equipment, fitness equipment that you could buy at a retail store, and like weight loss programs, but not food. You'll see it. I'll put it in the chat. But
Okay. And also,
everything else is just ask for it.
We'll put it on our we can put it on our Facebook. There's a group of people who've been discussing it on the closed group and the Facebook closed group in terms of sharing things that have worked for them. And so I would encourage everyone to continue doing that. I think it will come up again as part of our as part of the bill, because there will be an increase in the level. Right now, individual directed family, whatever, goods and services is limited to $5,000 of your allocated funds. So this is a conversation that will be continued. I think at this point, we probably ought to move on and try to close the meeting. And so Liz, you're up.
Me again.
You again.
Hi, everybody. I didn't introduce myself before. I'm France. It's so great to see everyone here. Thank you so much for being here. And I see, we get to know your names and see you over and over again. And that means a lot to us because we're here for you. So Alicia, Patty, Carol, Meg, and I hope we use your time wisely to keep you updated and informed. And as Patty said, we meet with the DDA every month. And that's one of the things that we don't ever want to stop doing. And now that the SelfDirection Act is about to become law in October, we're trying to get back and focus on more volunteer and leadership development and succession planning, sustaining SDAN into the future beyond the six of us. So here's the pitch, we'd like to see us continue for years and years and decades to come. And you can help us by visiting our website at marylandsds.org and donating. You can donate by PayPal, or you can write us at info@marylandsds.org. If you want to send a check, we can give you the address or help you out, answer any questions you have. We're here for you. Just email us anytime, and please do donate, support us if you can, so we can get that kind of regular income, so we can hire staff and pay the bills, pay the Zoom guy and the website place and the guy who does our videos and stuff. We really appreciate your help because it's a great, this is such a needed organization. We're really unique, and we really try to, do our best to speak and help everyone that is in this room, and Maryland participants and families in self-direction, mostly participants. Thanks so much, and I guess that's it. Anybody have anything else?
Somebody asked if we have a Venmo. So if we don't, we should get one.
We can get one.
Yeah, I'll have to look at
we use M&T.
We use M&T Bank, so we'll figure that out. You can also pay through donate through Facebook as well, if that's easier. Facebook will and you can if anybody uses Amazon Smile, you can designate us as your 501c3 charity, and we get little bits and pieces, and it all adds up. So and again, if you can't volunteer. eBay. Oh,
if
eBay
you sell
too,
on
right?
eBay.
Yep. So also, along with the cash to keep us going is your time and volunteers. And I want to thank everybody who did put their name in the chat to help us with a couple of work groups that are coming on board now. So again, thanks everyone. Keep us informed. Let us know what's most pressing for you, and we'll see you soon.